quickly say your name and what organization you're with. We have a nice group here. We can see everyone on the screen, so it's a wonderful way to connect real quickly. So as I said, I'm Elizabeth Boyle. Amy, would you introduce yourself? And then I'll go ahead and call on people, actually, I realize that. So Amy Hockenberry.
Yeah, hi everyone. My name is Amy Hockenberry. I'm the Health Information Assessment Supervisor here at the Whatcom County Health Department, and here to talk to you about vaccines today.
Thanks, Amy. Melissa.
Hi everyone, I'm a public information officer with the Whatcom County Health Department, and I'm here just helping out behind the scenes.
Thank you. Erika.
Hey everyone, I'm Erika Lautenbach, and I'm the Director of the Health Department.
Okay, and Donna.
Hi, I'm Donna Ramey, and I'm with the Bellingham Chamber of Commerce.
Thank you, Donna. Sandy.
Sandy Ward, Bellingham, Whatcom County Tourism.
Scott.
Scott Ward, Executive Director of the Fairhaven Association.
Thank you, Scott. Corey, great to see you. I think you might be muted, but it doesn't say you're muted. Okay, I got it. Thanks for being here, Corey. Okay, and Darren?
Hi, Darren Klein, Whatcom County Health Department. I work with businesses and businesses to help them interpret the governor's guidance and also to do compliance.
Thanks, Darren. Thank you very much for all your hard work. Elizabeth Larson. Okay, Paul Neighbor.
I'm finding back. Paul Neighbor, and representing Bible Way, which is a British Columbia church that serves British Columbia, Lower Mainland, and Whatcom County, Skagit County, and I'm also a clinical pharmacist.
Great, thanks for being here, Paul. That's a lot.
Thank you.
Thank you. Hi, Alice.
Hi, I'm Alice Clark. I'm the Executive Director of the Downtown Bellingham Partnership. And I'm going to not have my profile up because I'm multitasking like 3 things and listening though. Great. And Jennifer's on our team and she's here as well. So
great. Thank you, Alice.
Yeah, you're welcome.
Okay, is it Tia or Thea?
Hi, I'm Thea with the Bellingham Bar and Restaurant Network. I'll be switching over to the real computer in a second because I'm not a fan of the phone. Thanks for having me.
Thank you. Thanks for making time for it. Tiffany.
I'm Tiffany Rich. I work for Whatcom Transportation Authority, and I'm just kind of part of the committee, kind of finding out more about vaccines.
Perfect. Thanks, Tiffany. And Jennifer, and then Nick.
Wow, there's both of us today. So Jennifer Walters, Downtown Bellingham Partnership, Retail Advocate, Economic Development. Hi, everybody.
Thank you, Jennifer. Okay, Nick, and then Brian.
Yeah, Nick Lanning, Linden City Council.
Great, thanks for being here, Nick. Okay, Brian, and then Zach.
Brian Page, I'm a partner at the law firm Carmichael Clark.
Okay, great, nice. Thank you for being here. And Zach, and then Emily. Okay, Emily.
Hi, everyone. I'm Rep Rules Legislative Assistant. Thanks for having me.
Oh, thanks for being here. Yes. Okay, Jennifer, and then Guy.
Jennifer Novak. I'm the Research and Communications Manager for the Regional Economic Partnership at the Port of Bellingham.
Thanks, Jennifer. Guy, and then Deb.
Guy Tragrasso, President and CEO of the Bellingham Regional Chamber of Commerce.
Thanks, Guy. Okay, Jed.
Jed Holmes, Community Outreach from the County Executive's Office.
Great, thanks for being here, Jed. And Holly?
Yeah, Holly O'Neill, Crossroads Consulting, and I was helping with the Business Support Task Force earlier with the Health Department, and I do facilitation for organizations around town. Nice to be here.
Good to have you. And I think my screen kind of rearranged, so I'm curious who else did not get to say hello. Are we good on that? Great. Thank you, Erika, for that idea. And let's see, we're going to go ahead and get started. Our hope is to address all your burning questions about the vaccine as much as the information is available. We'll get started with an introduction and welcoming from Erika first, and then followed up by Amy. Then we'll have several questions that have already come into the health department and have been repeated several times. So we thought we'll go ahead and start with those 3 questions, and then we'll have an open Q&A session. And when you have a question, if you can just put it in the chat, it'll go directly to Melissa Morin, who's the communications director, and she'll share those back out for the Q&A session. So our intention is to be wrapped up here by 12:45. So we're hoping to answer all your great questions during that time. And if we're unable to, we'll do our best to do some follow-up afterwards. So as we get started, Ms. Erika Lautenbach, our Whatcom County Health Director, thanks so much for being here today and starting it off.
Yeah, thanks to you all. I am looking forward to the conversation, and hopefully we'll be able to answer some of your questions and really have a good dialogue about how we can support you and your business or your organization. I want to start out by just kind of giving the lay of the land with vaccine because the process is a bit opaque, and it's a bit opaque for all of us, including the health department. And I kind of just wanted to describe where we are and where things sit at the moment. So we recognize that there's a lot of frustration about vaccine. This is a national vaccine shortage that trickles down to the state, that trickles down to the county. And given that we're kind of the end of the line for frustrations, we're hearing a lot from folks about why Whatcom County isn't getting more vaccine, why we aren't moving to more phases and opening it up to more people. And I just kind of want to give you, again, that lay of the land. So at this point, our only limitation is vaccine supply. We have 34 enrolled provider sites and a system built to expand even further. So what's great about having so many provider sites is people can go to get a vaccine where they're comfortable, whether it's their primary care doc or the pharmacy where they already get their prescriptions. They can go where they know people and are comfortable and have a relationship. Because we have so many sites, there's the small local pharmacies all the way to the big national chains. There's also single provider practices all the way up to Family Care Network and Peace Health Hospital. So there's a lot of different options for people, and all of these providers have really ramped up and they're ready to go and they're ready to accept vaccine, and there just isn't vaccine at this point. And I want to describe the process just very briefly because this has resulted in some confusion and a lot of concerns about not being able to make appointments, not having information about who's an enrolled provider or who has vaccine. So the way it works is this is a week by week process. Every week, the state has every enrolled provider send them a survey of how many vaccines they want to accept that week. They will return that, and then 2 days later, they receive notice from the state saying, this is how many vaccines you're going to receive. Sometimes, rarely, but sometimes vaccine providers are able to get a good percentage of what they've asked for. But for example, and Family Care Network shared this a couple of weeks ago when we did another town hall, that a few weeks ago, they asked for 4,000 doses. Just Family Care Network alone can today ramp up to 4,000 doses in a week, and they received 0 doses that week. So it's really challenging for all of us, and especially kind of crazy making for our providers, because they've added staff. Some of them have their own new clinics, and they're willing to pay people overtime and change their operations so they can both provide clinical care and vaccines on a rapid basis. And week by week, they can't plan. They can't determine how many staff they're going to need, what hours they can schedule, if they can schedule appointments or not. Family Care Network, for example, was hoping that they could schedule appointments, but that day that they found out they were getting 0, they realized, okay, well, whatever we've scheduled, we have to cancel, right? So it makes it really challenging for all of us. And it also makes it challenging for people who are trying to schedule an appointment, because more than likely, the appointment they schedule, if they schedule it in advance, will change or be canceled based on the supply, right? So I just want to share that because this isn't a Whatcom County Health Department problem or issue. This is something that's systemic through just the sheer process of manufacturing all this vaccine nationally and internationally. So there are some vaccine providers in our community that are open to everyone right now, not just to their patients. And they will, this list will expand as there's more supply available. A lot of these issues, a lot of the frustration will be resolved once we have supply. That there won't be a shortage of providers, there won't be a shortage of appointments, et cetera. But the providers that have already indicated that they will take anyone in the community, not a patient, Seymour Community Health Center, and then a lot of our pharmacies, right, including Safeway, Hagen, and Costco, and likely many of our smaller pharmacies. So in the meantime, we know this is really frustrating for everyone, but I hope that a little bit of context gives you an idea of kind of the tricky spot all of us that are participating in this process are facing at the moment. So I'm going to turn it over to Amy to provide some more detail about kind of where we are, how many folks are eligible, and how many we've vaccinated, and some of the details. Amy is not only our Health Information and Assessment Supervisor, but she is our vaccine czar, appointed by me. Informally, she is the czar. So she has all the details and information and is just a wealth of information. So go ahead, Amy.
Thanks. I'll try to own to that tall order. Yeah, so I wanted to give a little bit of the kind of a status update. That was, I think, a really great overview that Erika gave you about how things are going. So for Whatcom, I'll give you a status update, and then I'm going to cover a little bit about how do you know when you or your employees are eligible, and if so, where do they go? So for our status update, our data is being updated pretty much Monday, Wednesday, and Friday from the Department of Health. So as of last week, February 10th, there's been almost 9.5% of Whatcom County residents that have received their first dose, and we're almost at 3% of residents who have been fully vaccinated. So they've received first and second dose. There's been a little over 21,000 doses, first and second doses given in Whatcom County by Whatcom County providers. And then as Erika mentioned, we get allocations are coming by the week. So as of this week, we're almost to 18,000 first doses that have been allocated to Whatcom County. But this week, particularly, and this I think really speaks to what Erika was speaking to, is that we've had 0 first doses coming into Whatcom County. And that's because the state sort of needed to reset and make sure that there was enough second doses being allocated statewide. So even though we had a lot of providers requesting and ordering first doses this week, we've had 0 come in for first doses, but we've got 2,400 second doses. So again, you get a way to see that fluctuation of how things are rolling at a local level. So hopefully at the end of this week, we'll see an increase in numbers of people who are fully vaccinated. And then so for knowing when or how to know when you or your employees are eligible and where to go to get vaccinated. So we are hearing from the Department of Health that it will be spring before we go into the further tiers of phase 1B. So if you looked at those tiers, we're looking at, and some of those those tiers may include some of you or your employees. And so the best way to determine this is that we recommend to go to what we call Phase Finder, what is called Phase Finder. So that's www.findyourphasewad.org. I think some of these are going to be put into the chat boxes. So this is an online tool that has people walk through a series of questions that lets them know whether or not they are currently eligible within a phase. And then if they're not, they can sign up to get noticed for when they are eligible. And then for those of you that maybe have employees that are friends or family that are currently available or eligible, the best way to make an appointment is to go to the www.covidvaccinewad.org. And so this is a site that provides a list of providers in our communities and how to set an appointment with them. I do want to take a step back. I did gloss over another way to figure out if you or your employees are eligible, is to look at the DOH's specific prioritization criteria that they have posted on their website. That's also going to be put in the chat box. So in any of this information that we're putting in the chat box will be shared later on. For those who are listening in, it'll be sent out in the Safer, Stronger Together weekly newsletter, and then also be posted on Facebook. So if you are eligible or if an employee is eligible, again, that list of employers will say on the covidvaccine.org will list those available providers. And as Erika was just describing, the lack of supply, which is the frustrating part, is that not all those people who are listed will, one, have vaccines available, or if they do, their appointments may be filled up. So right now, that is the best place to go to see who in our county has available appointments and how to schedule with them. So I think that's all I have to share at this moment. I think I'm handing it back over to Elizabeth or maybe it's Melissa.
Thank you, Amy, that was perfect. Okay, so we have a few key questions that really have been consistently coming into the health department, and we thought we'd start with those. And as we're going through these questions, if you have additional thoughts or reflections to ask Melissa, that'd be great through the chat, and then we'll open it up for them. So the first question we have today is, can a large employer or smaller businesses that are located close together arrange for an on-site mobile vaccine clinic to get employees vaccinated? And Erika, we're hoping you can answer that question for us today.
I can answer that question. Thanks.
Thanks.
So the answer is yes, with a couple of caveats. So obviously there isn't enough supply at this moment to be able to accommodate employers and their ability to vaccinate their staff, especially if they're not eligible at this point. And we're also optimistic that when there is enough supply, there'll be lots of options for employees aside from some sort of mobile vaccine program. But, like some employers, Whatcom County, for example, has a flu clinic where all the employees can go and get vaccinated, and it's a partnership with Costco. And there are going to be options like that through either occupational health providers that are enrolled providers, or employers can certainly do that through a pharmacy or another provider. That is not necessarily the role that the health department will play. Our focus, because we have so many providers that can do this work, our focus is really around vulnerable populations that may not have access otherwise. So that is our focus, but there's lots of occupational health providers, pharmacies, clinics, et cetera, where those kinds of mobile options could be arranged once there's more supply.
Great, thank you, Erika. Okay, the second question is for Amy. The question is, how should we prepare for when people are getting vaccinated? Is there anything that businesses should be doing to be prepared?
Yeah, definitely. First, we recommend assessing which of your employees want to be vaccinated. So that's very important to know. Also that some people, just acknowledging that some people do experience some mild side effects from the vaccine, and they might need to take a day off or two to recover. So sometimes people are feeling nauseous or achy, otherwise feel like they've had the flu. So we recommend anticipating this for when you want to plan work schedules. So if possible, try to stagger appointments, yes, and your scheduling so that everyone isn't vaccinated on the same day, or just make sure that you have enough coverage so if people need some extra time off.
Thank you, Amy. That kind of ties back into Erika's. I guess if you did a mass vaccine clinic and had the whole group, yeah. Anyway, next question, and Erika, we're circling back to you. And this has been one that's been coming up a lot. Can businesses mandate vaccines for employees?
So we've gotten this question a lot, and we talked with our legal counsel about, the health department can't provide you with legal advice. Certainly you can consult your legal counsel on this. To date, federal, state, and local authorities have not issued any sort of regulations or mandates. So our best recommendation for you is to sort of consult with your own legal counsel to determine if that's a step that you would want to take as an employer. But at this time, we don't plan to take action in that way and make it a requirement.
Thank you, Erika. Guy, do you mind speaking to that for a moment? I know we've had conversations around this.
Yeah, absolutely. I would echo what Erika just said. Always check with your attorney. Looking at you, Brian, on this one. So yeah, I think that is the disclaimer that I would say. We are aware of certain businesses that are already making that determination based upon legal counsel, based upon what industry sector they serve. I don't see CJ on the call today, but the Chamber and the SBDC are looking to partner together probably late next month, early April, when we have a little bit more information and hopefully a little bit more supply, where some of our businesses are to a point where they need to have this dialogue, putting together a panel dialogue with some attorneys locally to go over options and the need to know items. So I'm sure Safer Stronger Together will help promote that in their e-blasts, and as mine as well. Everyone should belong to their local chamber, and we'll promote that through our means too.
Thank you, Guy. Appreciate that. We'll for sure get that information out. I really appreciate the two organizations working together to make that event happen. And I misspoke. There's actually 5 questions to kick us off. So I have 2 more. The next question is back to Amy. Amy, once employees are vaccinated, do they still need to use PPE?
Yeah, another pretty common question. So the answer is yes. We should definitely continue to use PPE, practice social distancing, and washing, even if they've received both doses. So while we know that getting the vaccine can prevent us from getting sick, we don't know yet if it will prevent us from spreading the virus that causes COVID to other people. So until experts basically, until they've learned more, it's important that we continue to use all the tools available to stop this pandemic. So it's important that everyone continues to wear their PPE and practicing the social distancing. I do want to highlight the new guidance that came out of the CDC last week for people who are fully vaccinated. And I do recommend looking up this guidance. I don't think we have the link right now to put in the chat, but hopefully we can send this out later as well. So CDC came out saying first, if a person is fully vaccinated, but they have symptoms of COVID-19, that they should still isolate and take get a COVID test just like as if they would if they had not received the vaccine. And then second, I think this is super important for, as employers, if a fully vaccinated person's been exposed to COVID-19, they are not required to quarantine if they meet a particular criteria. So this is a little bit in the details, but means the criteria is 2 or more weeks since receiving their second dose, or more than 2 weeks from receiving their 1 dose if it's a single dose vaccine, which we're hearing the ones coming online here soon will be a single dose vaccine, that they're within 3 months of receiving the last dose in their series, and they've remained asymptomatic since their exposure. So those are just some details to consider about what your employees might be asking if they know they've been exposed or if they're having symptoms. So just some information to stay apprised of as things open up and more vaccines come online as well.
That's also helpful, if I can add, Amy, that's also helpful if you have employees that travel to other places. It lifts the requirement that they quarantine for 2 weeks after traveling out of state.
Erika, actually, we have one last question for you today, or one last of the official questions. What do we anticipate down the road? What can we look forward to from a planning perspective? For example, this is a tricky one. Yeah, should event planners plan for summer or cancel everything for another summer? Erika, give us a good word.
My crystal ball is only slightly better than any of yours. What I told my husband is that I hope we can start doing fun things in August. And again, this is just my own assessment of what it seems like things where things are going. I think the big question mark for us is supply of vaccine, frankly. If there are additional vaccines that come online, that will really help. If there is more supply in the coming weeks, that will really help. But if you look at the pace that we're going in vaccinating our population, it's going to be a long time. So unless we have more vaccine and more vaccine soon and significantly more vaccine, it continues to be a long road. We are optimistic, however, that there will be additional options, especially having a 1-dose vaccine would be such a game changer for our community. Just in terms of trying to schedule and prioritize, and it would be a huge advancement, but also just adding and ramping up more vaccine for the 2 that are available for us will make a big difference. When you think about this, our estimate is there's probably about 150,000 people in Whatcom County that both meet the eligibility requirements, so are over 16, right? And want to receive the vaccine. That's 300,000 doses if we still maintain these 2-dose regimens. That's a lot of vaccine to put in arms, and a lot of logistics and a lot of planning and a lot of supply, right? So that's the big question mark. And it's hard for me to predict what it's going to look like this summer based on not knowing what is coming supply-wise. I will share that we are considering on a 1-by-1 basis, and Darren's been really helpful in this. I'm glad he's on the call. And a couple of our public health nurses have been working kind of on a one-off basis with some of our event planners and are willing to do that and help in order to determine if those might be possible for this summer. So we aren't saying no, we aren't saying yes, open the door, but we're really trying to consider what this landscape might look like in the coming months.
Thank you, Erika. Guy, it looks like you might have a follow-up question to that.
Well, it's more of a follow-up statement and offer. The chamber is convened and is in the process of convening event planners, event facilities, so we can have a kind of a group dialogue on the needs. We are aware that many of our summer events are already canceled, in hopes that we can salvage and save as many of them as possible. On another meeting this morning, kind of made acknowledgement of something that I'm worried about is if we lose and this is not an advocacy to, we need events, we need to open everything up. So please don't understand that, but an awareness that if we go through 2 summers without events, we're going to lose a lot of capacity and expertise with individuals who are producing these events. So it's more of an advocacy for later on for Olympia and DC to provide some support for some of these organizations and entities that are producing these events so they can actually keep their trained staff up to do this. But we are looking to convene these meetings. I think we've got one planned for early March. If anybody's interested in joining in, shoot me an email, guy@bellingham.com, or shoot an email to Elizabeth, and I'm happy to include you.
Thank you, Guy. That's great. Okay, I think that wraps up our official questions, and now we're open for some Q&A that was turned into Melissa. Melissa, do you have some questions to share?
Yeah, we've got a couple of questions coming in, and feel free to keep sending those in the chat to me. But the first one is about second doses, and I think, Amy, this might be a good question for you to weigh in on. So just kind of how's it going with second doses? Are they being administered? Are folks having any trouble getting those on time?
Yeah, no, I'm trying to answer the second question. I want to answer first. For what we're hearing from our providers, they're not having any issues with getting second doses. Again, Erika spoke to the logistics, right? So there's logistics of of moving people through first dose and then getting them scheduled for second dose, and then making sure that there's clinical schedules so that they can still have time to do first and reach those second doses. The Department of Health has shifted how providers receive their second doses. So there was some confusion in the first few weeks about if their orders need to be placed or if not, and are they automatic and things of that nature. So there was a couple of bumpy roads in the first few weeks, but now it seems to have smoothed out. And they just took this week, the Department of Health, to really send out nothing but, or as much as possible, nothing but second doses to make up for some hiccups that happened in those, like about a month ago, around allocations around first doses. So it's a good move for the Department of Health. It doesn't, or it's good for us in the state. It doesn't move us forward in first doses this week, but it kind of rights some situations. So moving forward, everything should be moving smoothly. Let me know if I didn't answer your question. Yes, that. So if there's anything Erika wants to add.
No, we've received assurances that the booster, the second dose, will be commensurate with what we receive for the first dose. So there won't be issues of people getting their first dose and then not having available vaccine for their second dose. I think the other thing for you to know that's helpful is that we really recommend that folks get their first and second doses at the same place, because each of those providers is planning for first and second. And if people jump from one place to the other, that second location may not have the equivalent dose needed for that person. And then there may be a surplus at the place where they got their first dose. So the planning is very tight at this point. Again, another reason why having a 1-dose course would be incredible. So yes, so if you do have employees that are eligible, just encouraging them to schedule their first and second at the same time with the same provider.
All right, thanks. And I think we've got another question for you, Amy. The list of vaccine providers that you can find from the covidvaccinewa.org site lists only 10 providers, but you've mentioned that there are 34 enrolled provider sites. And can you explain the difference between those two numbers?
Yeah, definitely. Yeah, those two numbers might always slightly look different. So each provider has the opportunity to opt in to have their information posted on that site. And they also have the option to then have it hidden. So if they received 0 doses for a particular week, they can ask the Department of Health just to sort of turn themselves off for the week. And that's really, if you can only imagine the volume of phone calls that they would be receiving, even when they don't have any vaccines available. So I do know that I believe it's even tomorrow, even the Department of Health is working on changing, sharing out information about who has vaccines, do they have any open available appointments. And so we're looking for that shift to happen later on this week. So right now there is a little bit of a difference from what we will always tell you is the number of rural providers and what's listed on that website.
And I'll just add to that, we're not actually sure when that change will happen to that vaccine providers list. Amy and I haven't had a chance to check in yet today. And we didn't get confirmation from the State Department of Health that they would be making those updates to that vaccine providers list. But we have been told that some improvements are coming that'll make it easier, like Amy said, for people to see which providers currently have supply. Okay, we've got another question here saying folks have been hearing that that people are leaving Whatcom County to get their first dose in other counties. Is this advised? How does it affect where they get their second dose? And I think either Erika or Amy, you could chime in on this one.
Well, we're hearing this a lot too. There are folks from other counties that are getting vaccinated in Whatcom County, and there are Whatcom County residents that are getting vaccinated in other counties. And we're fairly agnostic on that. We don't have strong opinions. If people are eligible and they're able to be vaccinated somewhere else, that's great, that's good. But again, just reminding people that if they do go to Island County or Skagit County or Snohomish County, that they should plan to get their second vaccine there as well.
Thanks, Erica. Seeing a couple variations of a question here that Erica, maybe you can speak to. Kind of looking again, maybe into your crystal ball to forecast a little bit about the federal and state supply. Have we heard anything about an increase in supply coming down the pike, and not just specifically to Whatcom?
We're always hearing that there will be more supply. We have yet to see that, but we are hopeful.
All right, I was going to say we might have time for one more question after that, but I think we might have time for a couple more. We've got a question here in terms of the share of the vaccine that's coming to Whatcom County relative to elsewhere in Washington State. And Erica, maybe you could speak to that.
Yeah, this has been a point of concern for our county. There are differences, and somewhat significant some weeks differences in what counties receive how much vaccine. And that's been troubling for our elected officials and frankly for us to help describe and understand what is going on and why Whatcom County is receiving X number of doses and other counties are receiving X number of doses. We've been in conversation with the State Department of Health about creating more transparency around the criteria by which they determine which counties will receive what allocation each week. And I know that they, and maybe Melissa, if that is on their website, they do have a map that they update every week that shows how many doses each county has received and what percentage of the eligible population has been vaccinated. We're hoping to kind of see a right sizing of that, because especially early on, there were some counties that were ready to go, that had vaccinated all of their healthcare workers and their first responders, and were ready to move on to that 65 plus in multi-generational households. And then there were others like Whatcom County and other counties that were not ready, that had nowhere near the supply. And that just creates problems on both sides, right? It creates problems because it makes our waiting list longer. It's just a longer line when you add more folks who are eligible, and that creates frustration. On the flip side, those counties that are ready to go are now holding on to vaccine, which is certainly not the intent either. So how do we help encourage the state to make sure that the dosages meet the allocations meet the needs of each county in order to move in synchronicity through the phases, rather than having some that are ready to go and others that are really far behind. So that is an ongoing conversation.
Yeah, and to the best of my knowledge, DOH isn't regularly posting those allocation numbers on their website, but they have posted it on their Facebook page in the past. And I was just scrolling through rapidly to see if I could find that post. And I found the link, which I'll share out in the chat in just a minute. And I will just do a quick double check too to see if they are posting that anywhere on their website as well. I see your hand, Sandy, and I'm just gonna make sure that there's not a question in here that I've missed that came in before that. I do see a question here. Erica, have you or Amy, have you heard anything about a timeline for a single dose vaccine?
I can jump in. Are you okay with that, Erica? We just heard this morning on a partner call with the Department of Health that the timeline for the Johnson & Johnson, which right now is a single dose, with the EUA approval, that it might, if it goes through the process and it is approved, they would be at the end of February. and that Johnson & Johnson has said that they could turn around and start distributing vaccines within 48 to 72 hours. So if it all fell in the right timeline or within the projected timeline, it could be the first week of March. But that is, again, dependent on the approval process that they're in right now for the EUA.
That's the end of the questions that I see here, and I know we're coming right up on our time. So I think I might turn it back over to Elizabeth, and you can help wrap us up.
I was just going to say, Sandy, do you have a question or comment to add quickly there?
Well, I was just wondering if there's anything we can do as, civic leaders to put pressure or to help influence, whether it's with the legislature or, with our federal representatives. Is there anything we can do as business leaders to help make sure that we get our fair share of vaccine up here?
I've been in conversation with our legislative delegation at a state level, but certainly if you have thoughts or opinions that you'd like to share with them, I know they understand the conundrum that we're facing and the disparities between counties. And I'm not in a position to advocate as a county employee, but if you have thoughts or opinions you'd like to share with them, I'm sure they'd be open to that.
Erika, this is Emily from Representative Rule's office. I'm happy to speak to that as well. So this is something that Alicia has been working on since literally day one. She has sent a few letters to the Department of Health just asking for more clarification, just trying to get more transparent information about what we can expect. We keep getting the same answer time and time again, that there's just a shortage of supply, but it is something that is constantly on our office's radar, and we are working as best as we can, within her legislative power to be able to help support that. But feel free to reach out to our office if you have any questions.
Thank you, Emily and Sandy. I appreciate both of you adding that in there as well. Thank you. And it is time for us to wrap up today. So a big thank you to Erika and Amy for speaking. And a really big thank you to each of you that showed up today and made time for it. It's so important that people like you are out there sharing all the information you learn. And so we're just really grateful that you're invested in the process and trying to just keep our community healthy and moving forward together. So really appreciate all that. We'll have a recording and an FAQ sheet available on our whatcomtogether.org website. And if you have any questions that you didn't get answered today, or you get off the call like, why didn't I ask that? You can email team@whatcomtogether.org, and we'll direct the question to the right person to make sure you get it answered. But again, thank you so very much to everyone for showing up. And if you ever have anything that we can support you with, please let us know. So have a wonderful Tuesday, everybody. Thank you.